Infection with the severe acute respiratory syndrome coronavirus 2 that causes COVID-19 disease was shown to affect mothers and their babies alike. Pregnant women infected with SARS-CoV-2 have a worse clinical outcome than non-pregnant women, including higher risk for admission to the intensive care unit and death. Moreover, SARS-CoV-2 was associated with higher risk of major obstetrical syndromes. Although case reports and meta-analyses established a link between COVID-19 disease and preeclampsia, an important question is whether COVID-19 causes preeclampsia. Therefore, the primary objective of this study was to assess the relation between the severity of SARS-CoV-2 infection and the risk of subsequent development of preeclampsia. A secondary objective was to determine how the severity of SARS-CoV-2 infection relates to the risk and severity of preterm birth. This was a retrospective observational study involving 1,223 patients who tested positive for SARS-CoV-2 and were enrolled in one of 14 National Health Service maternity hospitals in the United Kingdom. Robust Poisson regression models and tests for trends and proportions were used to relate the severity of SARS-CoV-2 infection and the risk of subsequent diagnosis with preeclampsia and preterm birth. The analysis included adjustment for maternal characteristics and obstetrical history relevant to each outcome. Our results. The expected rate of preeclampsia given the maternal characteristics and obstetrical history of the population was about 1%. However, the actual rate of preeclampsia diagnosed at or after SARS-CoV-2 infection was about double, even in the absence of symptoms, and reached an 11-fold increase in patients with severe COVID-19. The dose-response relationship was also confirmed by a test for trend in proportions. Similarly, the rate of preterm birth less than 37 weeks increased monotonically from 11.7% in asymptomatic patients to 69.4% in patients with severe COVID-19. The severity of preterm birth, as defined by earlier gestational age at delivery, was also more accentuated in patients with moderate and severe COVID-19. Indeed, there was a dose-response relationship between the severity of SARS-CoV-2 infection and the risk of moderate preterm, very preterm, and extreme preterm delivery. In conclusion, we provided evidence that there is a dose-response relationship between the severity of SARS-CoV-2 infection and the risk of subsequent development of preeclampsia. The same was true for the rate of preterm birth, and the more severe COVID-19 disease, the earlier the gestational age of delivery.